Hi, welcome to Medical Monks, where your care is our highest calling. Are you home with an ostomy? Are you feeling overwhelmed by the many products that you may have come home from the hospital with or have accumulated? We have all the answers for you. Well, at least some of them, because you know the greatest teacher in life is life itself and what you experience and what you do. And that leads us to Ostomy Awareness Month. We're going to share some things with you we think will help. Setting yourself up for success is the best way to start applying your ostomy supplies from start to finish. It takes a lot of stress out, especially when you're organized and you have your pouches with pouches, your barriers and everything. And so once you start, you have everything out on your bathroom counter or wherever you're going to change your appliance. So let's get started. As you see here, I do have some duplicates of things, and I'm just going to choose what I feel like I'm going to use today. First off, I'm going to clean around my stoma, and I have this little schematic here, and I'm going to clean it. So we're going to be working backwards because we're starting from scratch. So we're going to take the skin barrier spray and spray it around. It's okay if you get it on the stoma. It will not hurt the stoma. Then we're going to measure our barrier and get that prepared. So that's going to dry a little bit. So then we take our sizing guide and we're going to measure our stoma. And we're going to fit it just right. There we go. So this is going to be the 35 millimeter. So I am going to line this up with 35 millimeter. And I'm actually going to save this plastic. So I'm going to measure this in the middle like that. And I'm going to take my scissors, and you need ostomy scissors that are nice and curved, which makes it so much easier to cut when you have a curved scissor, because you just got to be careful. So I'm going to cut this out. And sometimes when you have a dexterity issue, it could be a trouble, it could give you some trouble. They do make pre-cut. So once you've had your stoma for a little while, you can decide if you want to go for a pre-cut. It's always really good to just go ahead and, ream it around just so the edges are smoother and not so jagged, okay? Pull off anything that doesn't look good. So then we're going to, since we sprayed our skin barrier to protect our skin, and just a word of caution, less is best. Less is always best, because the products are really made to work with, our skin and the moisture to avoid breakdown. So we're going to go ahead and put our ring on around the stoma, and we're going to go ahead and make sure that when you apply that it is nice and tight to the stoma. So we have the ring, and the ring is around it. Also, before you put if you have some redness or some leakage, you can put a little bit of powder around the stoma. And make sure, blow it off, or get a paper plate or something to fan it off. Very little, and then prep spray it around, or use one of the prep wipes around the stoma. Next is take off the plastic sheeting. Now the plastic sheeting can be saved, so when you're ready to do your next application for your flange, you can use it to measure with. So if you want to keep it for next measure, go ahead and do that. If not, discard. And you can also use the paste. You would just beat it around the barrier and you could smooth it around. So right now we're going to put our barrier around, and what you want to do is you want to take your finger and go all the way around it like this, around. And this is called the floating flange. See how it floats up? So you can make sure it's nice. And then go ahead and pull the extra adhesive off. This is called an extended wear. Pull it off so you don't get it all stuck on your fingers, and press it through. You can see. Then to prepare, you want to maybe add some extra adhesive. These are wonderful. These are extenders, and once you take 3 of them and go around like this. I call it picture framing. People may have other ways of saying it, but I call it picture framing. And then once you have that, it feels pretty secure. Then we're going to take our, and you can also, like while you're ready to prepare your pouching, you can always hold it with a cloth, Kleenex, paper towel. Get your pouching system ready. We have a couple deodorants that you can use. One is a liquid that you can pour in. If you're in a 1-piece or a 2-piece, we're doing a 2-piece today, but this is a spray. You just give it 1, 2, 3, 4, and you can, it's a lubricant deodorant. And if you wanted to, you could even put it at the top if you have a 1-piece and just go inside, and it does make a nice silky feeling inside the pouching system. As you get ready, you can also close up your pouch and make sure you snap it shut, because it is like a hook and loop, and go ahead and apply your pouching system. And just give it a nice snap on. And go ahead and hold your hand over it when it's on your abdomen, and just hold it for like a minute just to give a little bit of heat from your hands. Kind of makes it feel better, and it holds it in place. Also, what you can use, especially at night or if you're going out for the day, you can use a belt that is adjustable, and they click on to these. Just click in like that, and they go around your waist to the other side, and they click in. This gives it a nice feeling of more security, especially if you're going out, you know, to play some pickleball, or you're going out to play whatever, golf. And so it just gives you a nice feeling of it's not going anywhere. And you can, this would be great at night, even when you're sleeping. This is the pouching system, the appliance as we put it on. So now we're going to take it off. Now we're going to remove the pouch and the barrier, because you're going to make a change. So we're going to snap off the belt, set it to the side. We're going to take off our pouching system, our pouch. We're going to take off our pouch, and it's always nice because they give you nice bags to put it in. And then we're going to use our remover wipe to take off the adhesive. And I'm starting to peel it off from the top, and it's very nice. It's and A lot of times you might even want to use like a tissue or something to take it off, or a wipe even, and just so you can get it off of your body easily and not to create skin stripping, because that's a thing and that can cause redness and pain. So you always want to take it off. It's really coming off nice and easy. This should already be started because as I was spraying it, it's coming right off. It's peeling right off. And then if it's stuck right there, make sure don't pull it off. Make sure you use the remover wipe because it'll make things a whole lot easier. You have a nice clean stoma, and then we start all over again. If you liked what you saw on our video today on how to apply an ostomy pouching system and removing it, please spread the awareness since it is Ostomy Awareness Month. Share with your friends, give us a like, and subscribe. Thanks for watching.